must be our goal and our guide. And all that we strive for as a human family, dignity and hope, progress and prosperity, depends on peace. But peace depends on us.
I'm joining the World Health Organization's Safe Hands Challenge. Hand washing is one of the most effective ways of preventing the spread of coronavirus. Wash your hands with soap and water for at least 40 to 60 seconds.
Humanity is at risk and stands at hazardous crossroads. Worldwide, the pandemic's impact on national health systems has been enormous. Even developed health systems feel the strain. Those of fragile developing economies are struggling to cope. The trans-border trajectory of the virus that makes us all neighbors, turn us all into each other's keepers. Above all, it recommends global partnerships across all the divides that may have set us apart. We now have to join hands against this global threat while acting in unison within our immediate national neighborhoods. Impact on national economies, on international relations, and on trade has been severe and continue to escalate daily. In our case, we have seen key bilateral projects in many sectors, notably in transport and infrastructures, either being slowed down or coming to a complete halt. Travel and tourism has taken a knock from a curtailed human movements. In our case, on the back of 2 successive droughts. While we have no recorded cases as yet, the economic impact of the pandemic is already being felt, threatening our Vision 2030. The key challenge we all face is balancing effective measures that are necessary and have to be taken against the need to ensure our societies and economies continue to function optimally for common collective good. Dear citizens, the pandemic has reached our region and we now have to escalate our national response. Above all, we must readjust our lives and behaviors, including foregoing certain fixtures, activities, and practices we had grown accustomed to in order to keep the pandemic at bay. This holds true at all levels, at personal, community, and national level. Government has decided that the coronavirus pandemic be declared a national disaster. This allows government to mobilize resources and take necessary measures in dealing with the pandemic. With immediate effect and for a unified and coordinated effort, I have directed that our national disaster management machinery extend its mandate and focus to dealing with the pandemic, with the Ministry of Health and Child Care as the lead agency. Weekly reports will have to be made to Cabinet. As already announced, government has curtailed unnecessary travel outside the country, especially to destinations in countries affected by the virus. That position remains in force. Travelers from high-risk countries are encouraged to postpone their travel arrangements to Zimbabwe for the next 30 days, starting from 20th of March 2020. Equally, Zimbabweans are discouraged from traveling to, through, and from high-risk countries during the same period. Non-essential travel must be avoided or discouraged by all of us. While all our major entry points into the country will remain operational, screening, testing, and other World Health Organization recommended measures will be enforced vigorously. To reduce the likelihood of infections and the spread of the coronavirus, government now put all hospitals and health facilities on a high alert for COVID-19 kits and other accessories for screening. Government has decided to postpone, curtail, or cancel public events, gatherings, and activities. In that respect, government has postponed the Zimbabwe International Trade Fair, ZITF. All national independence celebrations previously planned and the pending international sporting fixtures until the threat of coronavirus recedes. All these activities will resume as soon as we are satisfied that our nation is no longer at risk. Gatherings of more than 100 people, including those for purposes of worship and weddings, stand suspended for the next 60 days, after which the suspension will be reviewed.
Fellow Kenyans, the coronavirus disease has continued to affect the world in an unprecedented way. Global statistics today indicate that there were 266,073 confirmed cases and 11,000 deaths. The epicenter of the virus has shifted from China to Europe. In Africa, confirmed cases as of March the 21st were 572, with 12 reported deaths. On Friday, we announced that there were no new coronavirus cases, and that the 7 patients who were tested positive for the virus were undergoing treatment and were stable. We continue to monitor their progress, as well as the individuals who have come in contact with them. And I may add here that they continue to be stable. In the last 72 hours, however, we have received confirmation of an additional 8 cases who have tested positive for coronavirus. This now brings the total number of those who have tested positive to 15. Out of the latest 8 cases, 5 are Kenyans and 3 are foreign nationals. The foreign nationals are 2 French people and 1 Mexican. All the 8 are imported cases from Europe and America. The ages are between the age of 20 for the youngest and 57 years for the oldest. All the 8 came through the Jomo Kenyatta International Airport between the 4th of March and the 17th of March. And they all have been isolated at various facilities and are being monitored by our teams. We are tracing 363 persons who had come into contact with these patients. So far, we have also an additional 3 people waiting processing at Bagathi Hospital. The rest have been processed and discharged. All the patients, except the one who is at the coast, at Msambweni, are all in stable condition. The government is organizing to having the patients in Msambweni airlifted to Nairobi for further treatment. As I mentioned on Friday last week, our actions continue to be guided by the trends that we have observed in other countries. Evidence from other countries indicates that the number of infected persons increases dramatically in the second week following confirmation of the first case. I did further indicate that these coming 2 weeks are extremely critical for this country as we seek to contain the outbreak. We remain focused on emphasizing high levels of hygiene and the maintaining of social distance as the most effective containment measures. This morning, when we were launching the CT scan center in the Jomo Kenyatta Hospital, you will recall, those of you who attended the conference center, the press conference, that throughout the discussions with doctors from many centers in China, the French doctors as well, the emphasis was on exactly the same thing: the levels of hygiene and social distancing as an effective measure. Fellow Kenyans, the government has, in the first few weeks, announced various measures that are aimed at containing this virus. However, much to our disappointment, we have noticed that majority of our people have continued to ignore these measures and are behaving as if it is business as usual. As I cautioned last week, this disease is not a joke. Kenyans must treat this matter with the seriousness it deserves by adjusting and changing their lifestyles. If we continue to behave normally, this disease will treat us abnormally. Behaving normal under these circumstances is akin to having a death wish. Therefore, in addition to the measures that we have already announced, the government has today resolved as follows. Number one, all international flights are suspended effective Wednesday, the 25th at midnight. The only exception to this rule are cargo flights whose crew must observe strict guidelines. Those coming into the country between now and Wednesday, may they be Kenyans or foreigners, will undergo mandatory quarantine at a government-designated facility at their own expense. Countries wishing to evacuate their nationals must make their arrangements to do so within this period. Kenyans who are currently in foreign countries and will not have come back within the said period are advised to observe the guidelines issued in their respective countries wherever they are. Number two, whereas we had allowed Kenyans and foreigners with valid residence permits to come into the country, we have observed that there are those who are not observing self-quarantine protocol. Consequently, NAC has decided that all persons who violate the self-quarantine requirement will be forcibly quarantined for a full 14 days at their cost, and thereafter arrested and charged in accordance with the Public Health Act. And I would like to add here that this will apply to our senior government official in Kilifi who defied and refused to self-quarantine, who is now being forcibly quarantined in a facility, and upon the completion of the period given by our health authorities, the person, the official, will be charged in a court of law. And this will be followed by each and every person who violates this. I would like to urge, particularly those students traveling from the UK, traveling from the US and other countries, to observe this rule very strictly. And it will be enforced. And further, I would like to appeal to the younger people who are coming not to be close whatsoever to the older persons, because as has been shown by statistical evidence elsewhere, as soon as the young people come into close proximity with older people, the older people begin to die. So even as we talk about quarantining and we talk about distancing, it is important for people to remain alive to the fact that the older people are a lot more vulnerable. 3, effective midnight tonight, all bars will remain closed until further notice. Restaurants are to remain open, but only for purposes of facilitating takeaway services. This is meant to secure the social distance requirement, noting that the increased risk of transmission that those facilities can cause. Further, in order to give effect to the social distance requirement in public transport sector, all public service vehicles must adhere to the directive issued on Friday, March the 20th, failure to which the respective SACCO licenses will be revoked. The Inspector General of Police, who is present with us here today, has been directed to enforce this directive. Lastly, having noted the non-compliance of individuals, may they be in religious organizations, may they be in other social gatherings, as issued on the 20th of March, the NAC has directed the suspension of all church, mosques, funerals, and other social gatherings, and funerals are restricted to immediate family members only. Members of the Fourth Estate, you will remember that the experience of Italy started exactly the way we are behaving, where we have told people not to go into gathering, but some of them have decided, because of tithe and because of contributions in a church or because of contributions in other gatherings, that they must continue to do so. We all know what is happening in Italy today. Yesterday, 789 people lost their lives in 24 hours. There is nothing that we have done that is not going to give us exactly the same experience if we exhibit exactly the same behavior. It would be responsible of this government to allow this sort of behavior to continue, knowing very well what consequences they are. When you go into this kind of social gatherings, it is almost like committing suicide in the long run, in the medium term. And the social media today is abuzz with individuals who are nauseated by the behavior that Kenyans are exhibiting, even as we know the circumstances that are ahead of us. Once again, we are aware that these measures may be inconvenient, but I assure you that they are necessary to meet the objective of keeping Kenyans safe. Long after coronavirus has been secured, we will still have weddings, we will still have churches, we will still have mosques. But what is the point of continuing with these institutions as if nothing is happening and cut your gathering post-coronavirus by half? What is the logic? What is it that I do not understand when we tell Kenyans this is not a joke? So in the coming week, you will be observing enforcement measures that the government will have to take to make sure that what we are saying is correct. Even gatherings, streets that are unnecessary should not be held. Stay at home. Stay at home. If you are not doing anything in the town, if you are not doing anything in the shopping center, if you are not doing anything in the dukas and kiosks, if you are not doing anything in the market, we should only be opened along guidelines that the security operators are going to observe. Go home. Stay at home. People are getting sick because they came in touch with somebody else. The people we are talking about, the 8 people we are talking about, some of them are tourists. They have been to the pubs, they have been to the hotels, they have come in touch with some of us, and you don't know, as you speak next to your colleague, you don't know who is sick. And therefore we are saying this is not business as usual, and we will ensure that it will not be.
Good morning. It is the 23rd of March 2020. As we wake up, it is a beautiful morning here in Nairobi. I don't know where you're watching us from this morning. Good afternoon, good evening, and thank you so much for finding time to be with us today, even as the world still is, grappling with this coronavirus, threat that has now really changed the course of life, not just here, but across the globe. And that was a press conference from the CS of Health here in Nairobi yesterday, Mr. Mutahi Kagwe, and a lot of things there that he outlined, and of course he underlined and underscored. I think if you're listening to that speech, to that press conference there, churches yesterday opened, and personally I was not very happy about it, and a lot of Kenyans are not very happy about it, because why can't we not just follow simple instructions? And this is meant to keep us all safe, and to be our brother's keeper. So I don't understand. And you can see even the CS of Health there did not really understand. And so after that press conference now, they've made a directive that all religious gatherings so far, and all that will involve a huge number of people, have been banned. Church services have been suspended. Going to the mosque for the service have been suspended. Funerals will only be limited to the family members there, and because they're trying to restrict the number of people and a huge gathering, and that is the norm right now, not just here but across the globe. So I wish that Kenyans, and indeed all of us Africans who are watching this morning, we would pay heed and pay keen attention to some of these matters, because a country like Italy, which right now is leading with the number of deaths, I think stands at 5,476 just a few moments ago before I came in here. Perhaps I don't know if it has changed. These are just some of the things that they did not adhere to, and now even as we speak, the government has just imposed, even they've banned an inside the country travels, so that they're able to contain this virus. And so thank you so much for finding time. Dr. Matsangal shall be joining us in a short bit later there from the Political Command Center where he is. So right now, I'll just like us to take us through the newsmaking headlines, and we look at the leading newspapers, even as we wait for a press conference, a press briefing by President Uhuru Kenyatta. President of the Republic of Kenya is set to address the country in a short bit. So we're waiting for that. So once it's set up and once it starts, we shall cross all over. I don't know if it shall be at State House or his office at Jogo House, but we will know. But I suppose it shall be from State House. So let's just wait for that. So once that is ready, I'll take us all there. So in the meantime, thank you so much. Let's just go through some of the news-making headlines here in Kenya, even as we look at the current numbers across Africa as we continue with the show. And of course, based on that directive yesterday, on the front pages of the Standard newspaper, we see there a very stunning, headline there. And I know people are working to bring it on the screen agents of death. I think, and it continues to say, reckless actions. Deputy Governor Gideon Saburi roamed for 2 weeks, exposing the public to danger after violating an order to self-quarantine, having come from coronavirus-stricken country. Yesterday, defiant churches opened doors for Sunday services, oblivious of the risks to their members. It is such reckless actions that authorities blame for the spread of the deadly virus, as the number of confirmed cases in the country rose to 15, with 363 in contact with infected patients being traced. And now the government has rolled out mandatory tough measures to contain the scourge. So our headline there, nothing to smile about this morning from the Standard newspaper. And indeed, perhaps some Kenyans have not really understood the dire consequences or the seriousness of this COVID-19. And so they just go about their lives as if everything is normal. No, it's not business as usual. And it is time we realized that and changed how we even operate for the better of our own safety and the safety of others. So this Deputy Governor, apparently, the Kilifi Deputy Governor, Mr. Gideon Saburi, had travelled from Germany on March 5th. And even his own boss, the governor of Kilifi, gave him a 1 month leave just so that he could isolate himself and see if he has any signs or if at all he's sick. And then he refused to do that. And guess what? He's tested positive for the COVID-19. So it's, I was just watching another video in the morning. I think one of the officials there in Kilifi County that is now public. It's I think making rounds in the social media. So this person is really gutted, not very happy with this deputy governor because he got in contact with this person, and so, and among other, because he's been visiting the county offices, he's interacted with the county governor. As we speak now, the county governor for Kilifi is under a self-quarantine after he came into contact with his deputy governor, who even after coming back to the country refused to self-quarantine. So it is such measures that perhaps the government now will be forced to come in and force people to go into self-quarantine, because if you cannot self-quarantine now, the government will have to take you by force. And as we saw there, the CS for Health, Mr. Mutahi Kagwe, making it very clear that if you flount any of these measures or any of this directive by the government right now, then you might be facing some charges in court. And even as we speak, I think Mr. Mutahi Kagwe there, he said after this governor gets well, he will be answerable and he will be taken to court, and he will take responsibility for such a reckless move. How do you come back from a country that you know is very well has recorded a number of cases? And right now, the standard action is if you're traveling from anywhere from overseas and you're coming to your country, regardless of where it is, the best thing to do is self-quarantine. Everybody's doing that. So the fact that this leader refused to self-quarantine, went to the county offices, mingled and greeted people, attended functions, and acted as if everything is okay. Then a couple of days later, he's now tested positive for the coronavirus. I think it's very reckless. He was given a 1 month leave to just take care of himself and to isolate himself. He refused to do that. So this is somebody who I can say did this on purpose. I don't know. And so the government now is saying, even through the CS of Health, that once he gets better, and I pray he does, then he shall face the law. And I think that will be the right thing to do. And even now, right now, they're saying anybody who flaunts these measures that have been put in place by the government, then you will face the law in its full force. You cannot go around risking other people's lives. This is a serious matter, and I wish we will just look at it as it is, because this is not something to joke about. And you see countries, a country like Italy, a country like China now is not even registering new deaths yet or new infections, but we see the numbers there. Countries over the top 10 countries are in Europe and other out there. It's not even in Africa. Thank God the level in which this virus has been spread in Africa is not as much. But we've seen new cases every single day, and a lot of these cases are coming from outside Africa. And we're just asking one thing: why do we still have to allow people to come back home? if at all it's not a very urgent matter, why do we still allow people to come back to our countries? Why can't they just stay over there? I remember one time we had the Kenyan students who were were affected by the lockdown in Wuhan, Hubei province, where the epicenter of this outbreak at that time. And so they were crying and making all these videos, and it was very heartbreaking even for us Kenyans. We were wondering, okay, so what will be the best way to handle this matter? The government thought very wise, and I think they sort of sent help to those students, about 100 of them, and they said this will not be the right time to bring you home because of the risk that are involved. So as long as you're staying there, you've not been infected, you're safe. I think you're safer just being under that lockdown. And as you speak now, Wuhan, town, which is under the Hubei province there in China, is back to business, and they're going about their lives. So what if those students had been airlifted at that time as they wanted? I think they stood a higher risk of getting infected, and so the government found it not wise to bring them back home then. So we've not heard any cases then, so I'm assuming those Kenyans, the students who were there, the 100 of them, all of them are okay. And so right now, I don't know why we're still allowing in this continent, because all the new cases that are being recorded in Africa are coming from outside of Africa. I don't know why we're still allowing people to come into our countries. We should stop these flights henceforth. And even I've seen some countries coming in and now suspending flights from certain countries and things like that. I don't know it's the right move, but it could be just a bit too late, because as we see in Kenya, this governor traveled from Germany on the 5th of March, earlier this month. So you can imagine, and even the cases that have been discovered in this country came earlier. They traveled in the country earlier of this month. So you can imagine how many people we have allowed during this period. And so the cases in Africa can only be expected to escalate. I don't know, I hope they don't escalate to a level where now it will put a lot of pressure in our already, health system that is near broken. I don't know which country that has very excellent health systems here in Africa. Just a few of us, and so should the numbers keep rising, then this will be a real test to the different governments we have here in this continent. Thank you so much. Keep watching, even as we continue finding ways. And remember, if you go to the World Health Organization websites, there are a few measures that you could put in place. Very practical things and simple things that we've been assuming, just basic hygiene and health matters there. And so the World Health Organization is advising you, I'm telling you, to wash your hand frequently. And if you're wondering why, because regularly, when you wash your hand regularly and frequent and thoroughly, with soap and water, not just water, with soap and water, or using alcohol-based hand rub kills viruses that may be on your hands. So when you do that, you kill the viruses in your hands. Also maintain social distancing. Today in the morning, as I was coming to work, I saw, our public service vehicles that a lot of Kenyans use. A few percentage of us can afford private, vehicles. So majority of Kenyans use the public vehicles. They depend on that to go to work. A lot of children depend on that to go to school. That is how we get around here. And so I saw a lot of them adhered to that directive by the CS of Health yesterday. And this morning, if it were the small vehicles that were carrying about 14 people, so right now they're only allowed to carry 7. And if the big matatus, we call them here matatus, but they're buses that would carry 42 people, they're about, now they carry about a quarter of that. And you would see in a seat of 2 or 4, you only see one person. So, but the problem with that is that now a lot of matatus, or a lot of owners that ply these routes, now they've decided to hike the fares of these, public service vehicles. I cannot exactly blame them, because a lot of these vehicles sometimes they're still servicing the loans that they bought, so they have that to deal with. And also, if your car is running quarter the capacity or half the capacity one way, and you still have to pay for the same fuel, you still have to pay for the conductor and the driver. So it's a very difficult thing. And of course now the customers there, who are the Kenyans, are really suffering. So if you're paying, say, 50 shillings, you find that this morning a lot of Kenyans paid thrice the price. And so, the matatu industry or the public service industry, they came out and said, okay, fine, we shall comply with the directive, but we have to cushion ourselves. And the only way we're going to cushion ourselves is by, hiking the prices. And we've seen a lot of countries like Rwanda coming out and warning against what is called as price gouging. Price gouging is hiking and taking advantage of a crisis like we have right now. A lot of people you'll find are selling the hand sanitizers 3 times or 4 times the price. That is price gouging, and it is wrong. And now the fares have been hiked 3 times the price. So you wonder, if you were using 100 shillings to and fro, that is the mathematics you've done, and you knew this is how much I need to spend for this month. And remember, you're not going to get a salary hike to cushion, to take care of that extra bus fare that you have to pay for the next 2-3 weeks, or what. I pray it doesn't get to 2-3 weeks, because should the things continue the way they are, and then the economic and the financial implications are really, really going to be felt, especially from people who are on the lower tier of the economic pyramid. So this is a very dicey situation, and now the world, the few things you can do to keep yourself safe. If you don't have to leave the house, please don't leave your house. This is the time to just Netflix and chill. Just have a good time. Just go to Punchline Africa Television, watch us from your couch. If you really don't have to leave your house, we will be here to giving you the information. And later on top of the hour, I shall come, of course, back with the news making headlines across Africa, even as we look at some of the measures that some countries are taking, and also what is happening indeed across the world and outside of the COVID-19 virus. What else is happening in this continent? So as I said there earlier, Dr. Matanga shall be joining us later, just in a short bit, from the Political Command Center. And even as we continue to wait for that presser from the State House here, President Uhuru Kenyatta, the President of the Republic of Kenya, is set to address the nation. Remember, yesterday the CS announced more cases here in Kenya, and we stayed at 7 people for quite a few days now, and we were like, okay, perhaps we got this in control. And so yesterday he came out and said, now 15 people, now we are a total of 15 people who have been affected by this COVID virus. And that deputy, Governor of Kilifi is among the new cases, the 8 cases that the CS mentioned yesterday. And we've seen, among other raft of measures that the government has put in place, according to the CS there, restaurants from today will only be open for takeaways. Just go buy your food and leave that place. And, don't sit there to eat. That is the government directive. So I know Kenyans nowadays, you go to the restaurants from 10, they're all full. It's like the new eat business in town. If you want to come invest in Kenya, the restaurant business is booming at the moment, but as we speak, it has been greatly been affected. So the CS for Health is saying, if you must go to the restaurant to get you some food and leave. Don't sit there to eat, because you will be going against the directive that has been issued by the government. And I'm sure the government officials will be walking all over the place to see that people comply with these directives. And as well as from effective midnight yesterday, all bars have been closed. There's no opening. Remember, they were saying up to 7:30. Now they're saying, just buy your drinks, sit at home, be safe, drink there, and you don't even have to worry driving home dry. Just drink and go to bed and sleep, all right? So if you can stock in your house, if you have to do that, I don't drink, so I don't know how that will work out for you. But you must get a few, and then, just stay in your house and drink from there, go to bed and sleep. If you're going to work in the morning, find your way there. But they're saying all bars, effective midnight yesterday, have been closed down. And all, of course, I've said all public vehicles, and also they're required to have the hand sanitizer, which they all have. And also, as I said there earlier, the religious organizations, the church services have been suspended. Going to the mosque prayers, they have been suspended. If somebody has died and you have to attend the funeral, only the immediate family members only should be attending that the burial, and you're encouraged to make the burial arrangements as soon as possible. And of course, the CS noted that these measures will cause quite an inconvenience, but they are necessary, and we all agree. I mean, you want somebody to beat you up, for you to understand that you need to be kept safe. I don't understand. And I'm still very mad at the churches that opened yesterday. The pastors, the church leaders that thought it was very important for them to hold their church services yesterday, congregating and having these huge numbers of people coming to church. And you don't understand, because the only one effective way outside of washing of hands and keeping personal hygiene, and when you cough you get a tissue, you use it, or when you sneeze, and then after you've done, you throw it away. Do not use handkerchiefs because you reuse it again, and perhaps you might place it somewhere else. So when you use a tissue, a hand tissue, use it and then you throw away. If you're coughing or if you're sneezing. So can you imagine all these people who attended church yesterday, assuming one person had this illness? How it's so unbelievable. So it's very interesting here, this headline by the Standard newspaper. It's calling them the agents of death. I know Standard newspaper sometimes carries very interesting headlines, but this is very befitting, because how dare you sit there, congregate all these people together for the sake, I call it greed, because you don't want to miss out on the offerings, you don't want to miss out on the tithe, and you carelessly don't care about the people that are there under you, the people that have the potential of catching this illness. Because like we said, these people that right now are testing positive for this virus, they've had it in their bodies for quite a while now. It takes a few days for it to manifest, and that's why they have to put people under monitoring for 14 days. You could be walking, you think, oh, I'm fine, and maybe you're not, maybe you're having it. So you can imagine the risk when you're congregating 1,000 people, 500 people, 2,000 people together, and yet the government asked you nicely to ensure that if it's, just suspend the church services. And now the government has said it's a must. You have to suspend these church services. It's very unfortunate what is happening. So on the Standard, on the front pages there, the Standard newspaper, of course, is saying there's a portion there, the new measures, and of course, churches and mosques closed. Very good. Bars shut indefinitely. Very good. Burials only for immediate family members who don't exceed 15 people. Very well. Weddings have been burned. And I remember yesterday a friend of mine, the sister was supposed to be having a wedding. Is supposed to be having a wedding in April. And she's still insisting, no, my wedding will go on, I think April 17th or thereabout. And people are like, no, with this due threat, because you don't know where the country will be on April 17th. And she's insisting, my wedding will have to take place. I'm thinking, girl, are you living somewhere in a rock or under the cave that you really don't understand what is happening? A wedding, you can always have it another time, because what will the purpose? Nobody is going to come there to a wedding, or you want a wedding full of people wearing masks. I don't even understand. So she refused to call off the wedding. So let's just see how that will work out for that. So as we see right now, the government has banned the weddings. So obviously, she will not be having her wedding in April, and other people I know this will greatly affect, and also Kenyans and foreigners with residence permits coming into the country to be placed on mandatory quarantine in a government facility at own cost. Yes, because if you don't have to come to the country, don't come. So if you're going to bring yourself all the way here, then you're going to be taken to a quarantine, and you will take care of that cost. And that, I think, is what is happening in Uganda. And yesterday we were watching a clip. Was it from the CS of health there in Uganda? She's a lady, and she was like, no, all of you, she was at the airport herself. You've come to the country. Did you have to come to the country at this time? Okay, so we are taking you to mandatory self-quarantine. And while you do that, you will take care of the cost. And so the foreigners are like, no, we have to go self-quarantine. She said, no. Mandatory self-quarantine, the places where the government has ordered. So that's where we are taking you. Very interesting. So any foreigner who are coming into this country, and Kenyans who are coming now back to the country, if you don't have to come back, please don't. But if you do, you're going to go to self-quarantine, and then that will be at your own cost. And all international passenger flights have been halted. Very well. I don't know if this will be a bit too late, but I think this is a step towards curbing this menace. And anyone who refuses to self-quarantine will forcibly isolated and prosecuted. Very good. And also restaurants open for takeaway meals and matatus to observe directive reducing number of passengers. As I said there, for our viewers who are outside Kenya, matatus are the public service vehicles. We call them matatu. I don't know where that name came from, but yes, we have buses, we have mini buses, and we see them all over Africa as well. When you go to Uganda, I see them in Nigeria, I see them across the continent. It's only that we have different names for them. And so but that is the headlines on the Standard newspaper. And as I said there, I'll remind us that the President of the Republic of Kenya, President Uhuru Kenyatta, is set to address the country from, I'm assuming, State House, not his Njogoo House office. So once we are able to start, then we shall go right straight into State House there. Thank you and continue staying with us. Benjamin Kanu, good morning to you. Musa Waludi, you're saying good morning. Miriam and Doctor, good morning to you. Doctor will be joining us via Skype. He's been self-isolating for a while now. The whole of last week he's not been to the studio. He's coming to us from the political command center. He's so scared of this COVID-19 more than anybody I know, but he's safe over there and we're safe over here, and so it's good. And so he shall be joining us in a bit so that we're able to get his input on the show. And so Mbuyo saying the coronavirus gives African countries enough time to proactively prepare to prevent the outbreak of this virus, but they ignored and were lenient. If Kenyan leaders were smart, we couldn't reach the level of a lockdown. It will not destroy the economy. Other people laid off workers, etc. And Mbuyo, you know what? A lot of what you say there is the truth. We had every opportunity to protect ourselves, the whole of Africa, because it took a while before that virus came here, but we were so generous and lenient, as you put it there, and now we're here now. Segar Dior, you're saying you're watching from Assam. Where is Assam, please? And Sharif Mayaldin, you're saying good morning. Keep watching, and as you write to us, please let me know where you're watching us from this morning. This is Good Morning Africa, of course, and we are looking at the Kenyan situation, and I shall be coming to Africa and indeed the world, statistics just in a short while. We have another 10 minutes. Let's just complete with the Kenyan story very quickly, and then we turn to Africa and, of course, other news making headlines across Africa. I miss talking about other things, so we shall just bring a bit of that, but majority of it is still on COVID-19 because it's important we keep talking and create awareness so that we become our brother's keeper. All right, so let's just do our part. And on the Star newspaper this morning, the headlines read: virus, bars closed and flights burned. Police order to enforce stricter measures as cases of the corona rises to 15. Okay, quarantine tips. The 10 tips. If you're in the house somewhere or somewhere you cannot move, so the Star newspaper has wonderful tips that will keep you busy for the next, I don't know how long, where you are, how long you're supposed to stay indoors. Well, here is an adaptation of the advice Saint Jose Maria offered when he and others were besieged by war. It can help you cope better during the days ahead. I think this is just on a lighter note, but it could be helpful. So listen. Number 1, be optimistic. Approach it with a supernatural outlook, good humor, and hope. I guess like I'm trying to do right now, I'm not even sure. Number 2, have a schedule. So make a schedule to make a better use of your time. I don't know, you're just sitting in the house. If I was in the house the whole day on a lockdown, I think better use of my time will be between my fridge and perhaps my bookshelf and, I don't know, my bed, thereabout. So make a schedule to make better use of your time. But also this will be a good time to just read something, right? And number 3, don't waste time. Avoid overusing technology to pass the time. With the internet's availability in the houses, I don't know this Saint Jose Maria, this advice he offered. What time was it? I don't think it was the last 10 years that he was offering. This was during when he was besieged by war. This must be quite a while ago, because times have changed. So I don't know how you're going to tell people to stay away from technology, and people already are obsessed with this information, so they want to get it from wherever place they will get it. If they're not getting it from CNN, they're getting it from Al Jazeera, they're getting it on YouTube. So they're obsessed with technology and with the availability of accessibility of technology and the Wi-Fi in a lot of homes today, and the internet data. I don't know how this, this advice would work, but as Saint Jose Maria is telling you, avoid overusing technology to pass the time. Number 4, learn something new. Try out a recipe or start an online course that's been pending for a time. Now that's very good. For me, I would think I would try those 2. And also number 5, practice hobbies. Okay, now this is very interesting. So you practice music, reading, writing, sports. Okay. So this is the time. You see that hobby, that's something you always thought, perhaps I have potential in doing this. I'll just do it for fun. So this is the time, because you have all the time. If at all you're locked indoors, so this will be the right opportunity for you to go ahead and, just belt out those vocals and try some music, read something, write, sports. I don't know, sports. But you're indoors, so that would not really work out for you. And number 6, pray with more calm. Moments of physical break can become moments of great inner growth. Actually, that's very good. And then number 7, have good conversations with those who are near, or on phone and video conferencing with those who are far away. And number 8, be a support. Support those around you. Fear and boredom are great temptations. And also number 9, keep calm. Try not to focus on the negative side of things. Number 10, say you are sorry. Make sure to make amends with others when frictions arise. Come on now, that sounds like a bucket list. Say you're sorry. Are we preparing to die? I hope not. I know. But those are just quarantine measures, according to the Star newspapers, that perhaps might help you ease out and try to lighten up this very tough time that the world is facing right now. Other places in the world is a complete lockdown. In Africa, we still get to move around and things like that. But if you can go and stock on food, non-perishable ones, please, you do that, because as we see these cases every day, I'm not trying to be an alarmist, but I'm just saying it is better to be safe than sorry, and then sit in the house if you don't have to go outside. Tough new orders. All international flights suspended from midnight Wednesday. All bars closed until further notice. This is on the front pages of the Star newspaper. And this, I think, is from, that press conference by the CS for Health, Mr. Mutahi Kagwe. So I'll not go through it, I think. And they've said not disco matanga. I know if you're coming from outside Kenya, you might not even understand what this is. Now, this is usually when during the funeral period, especially from a community in the western part of the country, they have something called disco matanga. Matanga is a funeral, so disco funeral, something like that, loosely translated. All right, so they'll have like a party to celebrate. Usually from that part of the country, funerals are very, very important, and so it is the last send off. So it's like a whole blown party of some sort. So after that, they normally hold like discos in the night to dance the grief away or something like that. So no more of that. You people from the western part of the country, no more of the disco matangas. Only 15 members. Bury, go home. And if you don't have to travel over there, stop traveling. And this morning we saw the bus that will reply the long distance parts in the villages of Kenya. They're all filled up this morning. Kenyans are moving away from the city, especially Nairobians, and they're going to their villages. Now, see, that is another risk you're carrying with you all the way to the village. I don't know why people are panicking, and I don't know why people are moving. And so people are really, really moving away from the city into the villages. So I guess our older generation who we thought were there safe, now we're having all these people traveling from the cities. I guess it's not going to be safe for them anymore. And we saw there the CS while talking, he particularly said that the younger people who are coming from from outside the country or from the city and are traveling to the villages there, please keep a distance from the older people. They are more vulnerable and more susceptible to this because I think also of the immune system and other factors. So stay away from the older people. Stay away from your grandmother. Stay away from your mother, your father, your grandfather, your auntie. Those older generations, 55 plus. I'm not saying 55 years old, but I'm just saying that is according to statistics from 55 years plus. You stay away from them and just let them, be safe. And if you don't have to go there, if you don't have to travel to where they are, please do not. Just make sure that they are okay and they're provided for from a distance over here. I mean, we have the money, the mobile wallet now, so that should make it easier for you. I see we're almost on top of the hour here, and charge the week link. Let me just look at the front pages of the Daily News and Daily Nation so that we wrap up, and then we come back with Diaspora Dispatches, even as we continue to wait for that press conference from State House here in Nairobi by President Uhuru Kenyatta. So on the front pages of the Daily Nation, it says charge the week link, and then it continues to say lambs of slaughter, throwing caution and common sense to the wind. Thousands of Kenyans flocked to places of worship yesterday, repeating the deadly mistake of some of the countries that are now burying their dead by the truckloads. The government yesterday banned all religious gatherings, among other stringent measures. A very good move there by the government, and I am happy that happened. They're also outlining, and on the supermarkets, the CS said that they should stay open as long as possible, but limit number of customers allowed into premises at one go. I do not understand how they will do that, because right now, if you go to any supermarket here in Nairobi especially, I know it's on a Tuesday, on a Monday, you'll be surprised. People are really shopping, stocking up, and so I don't know how they're going to limit the number of people who are coming into the supermarket, but a lot of them nowadays are very spacious and airy, and so perhaps they can try to maintain the distance between the aisles. I don't know if that will be possible, but the government said it will not be in a rush to close such important places that people still require, and so the supermarkets should stay open as long as possible, but of course the government is saying now the number of people who are allowed inside should be limited. I'm not sure how that directive will be carried out. The implementation of that, you don't know, Kenyans. And yeah, I think that's just about it. And so far. Of course, the deaths that have been recorded, and not just here in Kenya, but across the globe. But I think these are things that I shall look at when we come back for the Diaspora Dispatches. This has been Good Morning Africa. Thank you for your time now. Take a pause. Let's cross over and meet after the break for Diaspora Dispatches, where we shall look at all things Now Africa. My name is Miriam Gutu. Good afternoon.